Baby loss refers to a loss at any stage. So it may be pregnancy, it may be after your baby is born. And loss generally we recognise as very difficult and very painful when we lose someone that we love. And when we lose a baby, that is equally as difficult. And historically, talking about baby loss, particularly in pregnancy, is something that's very, very difficult. So I think it's really important that we start to have those conversations in a very open, public way, so that we can support one another through something that actually may be one of the most difficult things that we go through in our adult lives. So following a bereavement, a lot of us will experience a huge range of symptoms. So people will recognise things like lots of crying, perhaps feeling very low in mood, perhaps not wanting to get out of bed and do things in your normal way. You might not take care of yourself in the way you did previously. If you have children, you might find that you're not quite as tolerant. You may find that you're irritable generally with other people, not just children, but partners, other loved ones. Sometimes people can kind of get quite angry with the world and how things are, particularly if it sort of feels like other people don't understand your experience. And with baby loss, particularly in the early stages, people may not know that you've had a loss, and that might also have quite an impact in how you're dealing with that. So grieving is a normal process, so I think it's very difficult sometimes to know what's typical and what isn't. But in my experience, people have a felt sense of whether they need more help. If you've experienced baby loss and you feel that that's having a significant impact on your mental health, then you can access support for that. So we have a maternal mental health service for women who've experienced this loss, but you may also access support via other services such as your GP, health visitor, and or your midwife. So with the baby loss pathway, it very much depends on what kind of loss you've experienced and what your needs are at that time. So everybody would be offered an assessment with one of our specialist team, and that assessment may last up to an hour and a half or 2 hours, where you can talk through with us what your experience is and what your needs might be. If you've experienced a loss in the later stage of your pregnancy or after your baby's born, you may also be being supported by a bereavement midwife. So they would also be helping you to make decisions about what you might need.